Hi everyone, my name is Abigail Dyer and today I'm going to be discussing the topic of advanced directives. So the big question in healthcare is, have you ever thought about who would make decisions for you if you could not speak for yourself? Today I'll be talking about advanced directives. This is a very important topic in healthcare because it's all about how we respect and carry out patients' wishes when they may not be able to speak for themselves. My goal in this presentation is to explain what advanced directives are, why they matter, the different types, some of the challenges that come up, and finally why they make such a difference for patients, families, and healthcare providers. So what are advanced directives? According to the NIH, advanced directives are legal documents that provide instructions for medical care and only go into effect if you cannot communicate your own wishes. These are basically legal documents where someone can outline their preferences for medical care in the event they become unable to make decisions for themselves. It usually addresses treatments such as life support, resuscitation, artificial feeding, or long-term care decisions. You can think of it as a way of planning ahead. It helps ensure that both family members and the medical team know exactly what the patient will want in this difficult situation. There's different types of advanced directives. The two main types I'm going to talk about, the first one being a living will. This specifies what kinds of life-sustaining treatments a person does or does not want. A living will is very specific. It spells out which treatments a person does or does not want. For example, a person may say they do not want to be placed on a ventilator, or they do not want an artificial nutrition through a feeding tube. On the other hand, you could have a healthcare proxy. These are also known as durable power of attorney for healthcare. This just names someone to make healthcare decisions on their account in case they are not able to. This type is often more flexible because medicine can be unpredictable. It allows someone the patient trusts to make decisions in the moment. So why does this matter in healthcare? Usually the conversation starts pretty early. Families are often led to guess what their loved ones would have wanted. This can cause stress, guilt, or even conflict between family members. So this just wants to avoid conflict, helps alleviate fights, especially when everyone has their own opinion. There are also financial implications that could alleviate family fights. Intensive medical care at the end of life can be extremely costly. Sometimes the treatments are not even what the patient would have chosen, and advanced directives can help prevent unnecessary or unwanted interventions. From a provider's perspective, advanced directives guide treatments. They make sure we're not doing either too much or too little, and they're staying true to the principle of the patient's autonomy. It allows for appropriate plan of care to be taken without going against the patient's wishes. So how does this work for providers using advanced directives? Usually the conversation starts during routine medical care, especially for older adults or patients with chronic illnesses. There's also exceptions that I'll get into a little bit later. Healthcare providers are actually required to ask about advanced directives when a patient is admitted to a hospital, a nursing home, or any other healthcare facility. Another important point is that advanced directives are not permanent. They can be revised at any time if a person changes their mind or if their health situation changes. Providers can also review wishes before making any medical decisions on behalf of the patient. They can also consult the proxy if need be. There's plenty of barriers and misconceptions when it comes to advanced directives. Like I spoke about in the earlier slides, you definitely do not need to be old to have an advanced directive, and that you definitely cannot change your advanced directives once it's put into place. Those two are very big misconceptions because you can have an advanced directive at any age, and if you decide to change your mind in 20 years or even 5 years, you're more in your free will to do so. Usually a challenge that many people simply never fill one out is because talking about end-of-life care can feel uncomfortable and people tend to avoid it until it's too late. Another limitation is sometimes the language in the document is too vague or situations varies that they were not anticipated. For example, a patient may not have considered a very specific scenario, and that leaves room for interpretation. This is where a healthcare proxy someone designed to make decisions for the patient when they cannot becomes super crucial. Finally, cultural and religious beliefs can influence whether people feel comfortable putting these decisions in writing. For some, it's not just a legal or medical matter, it's a deeply personal or spiritual one. Looking back on legal and ethical issues, it's always hard as a healthcare provider standpoint to want to do what's best for your patient, but if that's not what your patient truly wishes, you have to respect that in all forms. Looking at it at a legal standpoint, advance directives are legally binding in all 50 states. Specific ruling can apply. For example, this has become a very controversial topic throughout the years. Say a patient comes into the emergency department with a DNR tattoo. If they were to code into the emergency department, most emergency departments would have to perform life-saving measures because a tattoo is not a legally binding document. So you would have to know where your state falls with regards to DNR tattoos and things like that. I'm going to give a non-specific case study before I get into the Terry case study. So imagine a patient arrives in the emergency department unconscious after a major stroke. The doctors need to know right away whether to begin aggressive interventions, the intubation or surgeries. If the patient has an advance directive, the medical team can immediately follow the plan and provide care that aligns with the patient's wishes. If there's also a healthcare proxy, the person can help clarify any decisions that are uncertain. But without an advance directive, the family may be left struggling to decide and may not all agree. This can delay care, cause conflict, and add an extra layer of stress in an already devastating situation. This kind of scenario shows why advance directives are so important. So for my specific case study, this is the case study of Terry Chavajo. Basically, the case study is between her family and her husband. So Terry suffered from a cardiac arrest episode in 1990 where her husband did not perform life-saving measures, and she was left without oxygen until the ambulance arrived on scene and started performing CPR. When arrived to the hospital, Terry was placed into a medical-induced coma to prevent any other life-altering damages to her brain and the rest of her body. This led to a lot of confusion regarding ethics and feelings between her family and her husband. Her family on one side strongly believed that Terry should be placed under all care possible and should be treated to the highest extent, even if that meant her quality of life was diminished, according to her doctors. Terry's husband, on the other hand, thought that is not what Terry would have wanted, and he wanted her taken off life support immediately. This became a legal battle for several years, costing both sides thousands of dollars and lots of damage and emotional repercussions. In the end, the legal case was in favor of Terry's husband, where she was taken off life support in 2005, where she ultimately died. This whole thing could have been disregarded or even alleviated way sooner if Terry would have just had an advance directive. So to wrap it up, advance directives are tools that protect patient autonomy, guides families through difficult decisions, and support providers in delivering care that truly align with what the patient would want. They don't take away hope or limit care. Instead, they ensure that when difficult decisions come, those choices are guided by patients' own values and preferences. I encourage everyone, no matter their age or health status, to learn about advance directives, to have conversations with loved ones, and when ready, document their wishes. Thank you.